And she's jointly appointed by the Melbourne School of Psychological Sciences and Melbourne School of Health Sciences at Melbourne University. Her research aims to improve survivorship care by increasing access to high-quality multidisciplinary exercise support through innovative technologies that bridge the gap between what is available in clinic and what is available at home. As a behavioural scientist, she is passionate about ensuring exercise programs have both safe and appropriate exercise prescriptions, and also to support people to have sustainable lifestyle changes by addressing the psychological and social factors that impact on exercise. And she's currently working on the development and evaluation of digitally supported exercise programs for hematological, breast and prostate cancer survivors. So in this session, she'll be discussing her current research on hematological exercise programs and discuss some of the behaviour change strategies used to form exercise habits. So thank you and welcome, Camille.
Thank you, Donna. And yeah, thank you very much for having me today. It is a real pleasure to be invited and be able to link in with you. And I wanted to start with some disclaimers. So I have really only been working with hematological cancer patients for the last year. So I'm very well aware that everyone on this call can tell me more about lymphoma than I can. So I'm hoping that in the question time and we might be able to, I might be able to learn from you as well. And even though I specialize in exercise and exercise promotion, I do recognize that each person here knows more about their exercise thoughts, feelings, and beliefs than I do as well. So all that said and done, what can I do? I think it's good to start with the team in which I work in, because a lot of what I do stems from shared expertise. So as Donna said, I'm based at Melbourne University and I am within two different research groups, the Melbourne Centre for Behaviour Change that sits within psychology, and the Acute Physiotherapy Care Research Group that sits within health sciences. And my role is really trying to create a bridge between clinical exercise interventions and psychology and behaviour change. So I just wanted to acknowledge these are some of the core members of my team, and the consumers that I work with as well have really helped shape my understanding and work collaboratively on the projects that I'm going to talk to you about. So this is just a quick overview. I won't go too much into the exercise benefits, but I will talk a little bit about that. I wanted to take the opportunity to talk about what to look for in an exercise professional and exercise program. Try do a little bit of an exercise to start thinking about what is it that impacts on our exercise behaviour, drawing on some science and a little bit of interactivity. A very brief overview of some strategies that I think we can follow up on at some point, and a brief overview of the sorts of things that I'm doing now. So one thing I'll say is that we tend to, as researchers, distinguish between physical activity, which is any body movement, and exercise, which is a subset of physical activity, but it's much more intentional and it's designed to improve fitness and functional outcomes. Both are beneficial, but a lot of what I'm talking about today is the benefits of structured exercise and how to have an exercise routine. Examples of physical activity might be things like when we're doing the vacuuming and the gardening and we're working and that's active. All of that, it still contributes to your health, but it's not the focus of what I'm talking about when I'm talking more specifically about exercise programs. So it's no surprise to you, I'm sure, that we need support to help people when they have been diagnosed and have gone through cancer treatment to regain physical fitness, physical functioning, energy levels, and that there is a lot of evidence, mostly though from solid tumours, but accruing for hematological cancers, that exercise has benefits before treatment, during treatment, and after treatment. And these boxes just show a very basic summary of what some of these can be. So before treatment, it can actually help prevent you from being so affected. So if you increase your fitness levels beforehand, you experience less of a drop. There's some evidence that it can help you maintain treatment. So if you're on chemotherapy, for example, it can help you tolerate that better, which can have other benefits. And then post-treatment, it can help recover from any deconditioning that has happened. Can also help you be prepared if more treatment is needed in the future. And it can help reduce risk from other health conditions, some of which, unfortunately, cancer treatments can put you at increased risk of. And so there's pretty good evidence that, you know, exercise at all these time points is beneficial for increasing physical functioning, quality of life and happiness, and reducing fatigue, anxiety and depression. And this has been shown in quite rigorous trials with hematological cancer patients. And what we do know more broadly is that the benefits of exercise can be acute. So, for example, we do research in prehabilitation, which is helping hematological patients to achieve gains in physical functioning before a stem cell transplant. And that can be really beneficial because it has a kind of, I guess, an acute time frame. But I'm really also interested in the longer terms of benefits from exercise by having a exercise routine that extends across these times in our cancer care. So I won't go too much into this, but I just wanted to take an opportunity, because there's not that much research published with hematological populations. The acute physio group at Melbourne Uni has been doing research at the Peter Mac and the Royal Melbourne in Victoria. So this is just some preliminary data where they have set up a prehabilitation service for people who are going to have a bone marrow transplant. And they have basically shown, this is a sit to stand test, and this one here is a 6-minute walk test on the right. And they're both just good indicators of physical functioning that are associated with our abilities to perform everyday activities. So that they can be really quite highly related to our quality of life. And what we see is that if you can give an exercise program before the transplant, you do see these wonderful increases in fitness. And then that does decrease after a transplant. However, it doesn't, we're kind of being able to preserve baseline functioning or have improvements slightly above baseline. So that means like before you started the exercise program and before you had treatment. And importantly, we're not seeing declines further than that level, which is what we do see without an exercise intervention. It's very preliminary data, but they've also found that it can reduce length of hospital stays, which is obviously good for patients and families, but it's also something that allows us to advocate for exercise programs to health service providers, because it means that they, by investing in exercise, can actually save some money in their usual care. So it's those sorts of things that we're trying hard to show so that we can better advocate for patients to have access to these sorts of services. This is a program that was conducted at the Royal Melbourne by colleagues of mine. I'm not sure if this video will play. Can somebody talk to me in the chat just to make sure that they could hear that? Okay, you can't hear the sound?
Oh, I think you just Oh, you're back again. Sorry, you just froze
Yeah.
for a second. All good.
No, that's okay. I think the sound might not work on the video. I had a fear that would happen. I'll I'll just leave it for now, but this is Nine News covered the rehabilitation program that my colleagues were trialing at the Royal Melbourne. I wanted to show you because it shows you the sorts of exercises that they were doing, and there's some testimonial from patients that were involved talking about the benefits that they are feeling, and that they intend to keep doing this after the program ends, and that they hope this becomes a part of practice. It was scientifically evaluated, and we saw similar results to what we did in the prehab study, where you have people coming in at baseline, so before their bone marrow transplant. This is actually, all these lines are each individual person in the study. And you see this general trend where there's no intervention, where people are physical functioning is going down be lower than where they started. And then if we give an intervention sort of 60 days after that transplant, we see that their results do go back up and they regain physical functioning. So again, that's very promising. However, unfortunately, this hasn't been implemented after the study as a part of usual practice, and that's something that in the research that I'm conducting, I'm trying to investigate why, and develop models of delivery that might be affordable for the healthcare providers to implement, given there are clear benefits to patients. So I've sort of showed you an exercise intervention we've done before a stem cell transplant, and an exercise intervention we've done after a stem cell transplant. I think ideally we would have exercise programs available for people, obviously not just people who are having those sorts of treatments, but all treatments, and would have them across these time points. And this is something that is starting to be looked at. This is a team down the bottom here, Daniel Minnaert in Canada, who's just doing a feasibility study at the moment to see if they can implement an exercise intervention across these time points and what the effect of that is. So I'm quite excited to see the results of that. So that just a brief overview of some of the benefits. I'm sure you've heard a lot of that before. This is some survey data that I collected, or I'm currently still collecting. So we're looking for over 100 people. We currently have 28. But this is all around Australia. And these people predominantly have been recruited by Facebook so far. And we've been asking them questions about what exercise support they have been receiving, if they have, if they felt that exercise support was adequate, what are their current level of activity, and what are their opinions on different ways we could be providing exercise. And I guess I just wanted to reiterate that cancer patients and hematological patients, based on this data, aren't different from the population, in the sense, the general population, in the sense that most people don't engage in regular exercise, at least half of the population, to a level that would meet the national guidelines. Obviously, cancer patients have unique barriers and need unique support, but I think it's important in terms of not feeling guilty and being self-compassionate, that everybody finds exercise hard, and if you're finding it hard and you have extra barriers, then that's not surprising. And this is particularly in the context of where we're at in terms of providing support. So in this survey, 53% of people, so it's a small sample size, but half of people said that someone in their treatment team had spoken to them about exercise, but then only half of those actually received a referral to an exercise professional. And we look at if people attended that referral, most did, but there were people that said they didn't due to barriers like cost and distance. 30% had participated in the structured exercise program, And most people did feel positive that they were continuing on the exercises that they had been shown. There was definitely some people who had said that they weren't continuing exercise anymore. And when we asked about general activity levels, we look at aerobic, so like cardio type activity and strength-based activity. Actually finding that the people in this study so far are doing better with strength training than the general population. So usually strength training isn't something that we do very much as a society, but maybe through exercise referral and structured programs, the people in this study were actually, it was only 20% that weren't doing any. So that was quite promising. So that, one of the things I hear a lot when I'm working with exercise scientists and physiotherapists and people really advocating for exercise programs is drawing on this vast body of evidence that exercise is absolutely very beneficial for everyone and for cancer patients, and that if we could put all of the benefits of exercise into the pill, people would take it. And as a behavioural scientist, even though I wholeheartedly believe in the benefits of exercise, I have to say some people would take it. And we know this because when you look at the research on medication adherence is actually similar to adhering to exercise guidelines. So this is just a reference for a study that showed that 24% of patients didn't feel their cardiac medication after having a serious cardiac event. So it's just my way of saying that we need to acknowledge that exercise is a hard behaviour to uptake. And if taking a pill is difficult, then we're clearly going to need support to get people exercising. And I'd just, I guess, like to add that some people would take it and some doctors would provide it and some governments would fund it, but not all. So this is the sort of thing that I'm passionate about trying to progress with my own research. So with all that said and done, I wanted to cover what to look for in a professional and how to access one if you wanted to take this on yourself. So there are two types of university-educated exercise professionals who've had about 4 years of training each at least, a physiotherapist and an exercise physiologist. And the guidelines for exercising cancer recommend that patients see one of these types of professionals. Now, if you want to know the difference, a physiotherapist will probably say something different to an exercise physiologist. So even though there's a lot of cooperation, there's also a lot of professional competition, I guess, between physiotherapists and exercise physiologists. You know, they're competing for their own livelihoods, essentially. But in general, a physiotherapist is someone who's trained to assess and diagnose injury, disability, and pain, and they treat that through manipulation, massage, and exercise. Whereas an exercise physiologist is much more about chronic disease management through clinical exercise interventions. And in general, they probably have a little bit more training around self-management and behaviour change. But either professional, you can have an experience. This is from one of the consumers I work with who went to see an exercise professional after having breast cancer treatment. And she said, they treated me like anyone off the street, and they gave her lots of heavy weights to lift and progressed her really quickly, and that resulted in injury for her. So the number one thing I can say is that look for experience in a professional with cancer who has experience with cancer patients, particularly the type of cancer that you have been diagnosed with, which of course being more rare is going to be rare to find. So you need to also look for a good listener and someone who is willing to learn. And there are really good guides for exercise professionals. So if you live in a regional community where you have one exercise physiologist or one physiotherapist and they're not experienced with working with cancer patients, there are resources you can point them to that should give them a good indication of the things that they need to be really mindful of when they're working with people who are undergoing or have recently undergone cancer treatments. So this is the American College of Sports Medicine guidelines on the left, and on the right we have the Exercise Sports Science Australia position statement, which are really good resources for professionals, but they're not very layperson friendly. But if you're interested, it'd be worth having a look through. The benefit of a professional is that you can outsource some of that information and hope that they can take care of you, and you won't have to know all the ins and outs yourself. And you can actually access a physiotherapist or an exercise physiologist through a chronic disease management plan. So it is limited in scope. You get 5 free sessions with an allied health provider. So if you want to see a psychologist, a dietitian, and an exercise professional, that would take up at least 3, and then you would need to think of who you wanted to have a repeat session with. Thankfully, during COVID, Medicare is covering these via telehealth, and we're hoping that that stays. So previously, it had to be via face-to-face to access the Medicare rebate. Some private healthcare insurances do cover exercise physiologists and physiotherapists, so it's worth looking into that if you have private health. And some hospital-based, there are some hospital-based resources as well, and that can come in the context of clinical trials. So, for example, in our rehabilitation study, 43 patients were able to access an exercise program that they wouldn't otherwise have access to by participating in that trial. Ideally, we'd like to see this as a part of standard care, but it is one way of accessing free support if the hospital you're being treated at doesn't have any exercise support available. But it's worth asking whether or not they have a physio or a physiologist that you can talk to about exercise. And hopefully, if enough people ask, it might create some organisational change as well. In terms of finding one, the Exercise Sports Science Australia has this website where you can put in an interest. So you can say you want someone with a specialty of cancer. You can put in your postcode if you're trying to find someone close by. And what you want to pick here is AEP, which stands for Accredited Exercise Physiologist. Press find and it will come up with a list in your area. If you don't have anyone in your area, there are some telehealth options that you can access from anywhere as well. And contacting these professional bodies would be a good place to start. So there's ESSA, the Exercise Sports Science, so that's the governing body for exercise physiologists. And then there's the Australian Physio Association, which is the governing body of physiotherapists, and they have a similar website. So there are some online tools to help you find some. But word of mouth is also good. If you can, talk to people in the Facebook group about what physiotherapists or exercise physiologists have been good for them, that's probably going to be the best way of finding someone with the appropriate expertise. So that covers professionals. I just wanted to talk a little bit about, from my perspective, what to look for in an exercise program. So hopefully if you join a hospital-based program or a community-based program, the professionals will cover these points, but this is what I think of as my own quality criteria to help you pick between what different options that might be available. So often we try and encourage multimodal programs, which is basically just saying different types of exercise have different benefits, and so it's good to include both, but it does depend on the goals of the people in the program. But generally, something that has a mix of aerobic activity and resistance or strength-based activity is going to give you a lot of holistic benefits. Progress slowly. So where the consumer I worked with said they treated me like anyone off the street, this is one of the things that they didn't adhere to. So this illustration, you'll see that this person is carrying larger and larger loads over time, but you'll notice their face is not straining and heaving, and that's because, you know, they might have walked one day with a small load 10 times and they've done that all week, and then they can actually hold something a bit heavier the next time without really putting much more strain on them. So generally, it's recommended that you don't really want to up your exercise program more than 10% at a time. So keep that in mind if you're doing you know, 10 reps of an exercise. You don't want to start suddenly going to 50 with bigger weights, expecting a bigger benefit. Programs should modify based on how you're feeling. So one of the things that we do is we track pain levels. So some level of pain can be okay depending on how severe it is and if it lingers. But if you have pain over 3, that's when you stop what you're doing. So that's something that you would monitor your exercise prescription with for safety, but it's also important for enjoyment. So one of the things we recommend for cancer patients that might be having a good day and a bad day is also to have a plan of how you're going to monitor, how you're going to modify your program. So if you're feeling fatigued or nauseous or pain, you can still do some exercise, but you know you're going to do something that fits you a lot more that day. And that can help you sustain exercise over time, just by exercising to your capacity at any one point. As I said before, physical activity has a lot of benefits generally. Often I know myself when I go for a walk, I'm probably not walking at an intensity that would have the most benefits. So when we are trying to get some real benefits from exercise, it is recommended that we exercise at a moderate intensity. And you can measure this easily yourself by thinking of a scale of 0 to 10. 10 being extremely hard, so you're puffing and panting and you couldn't possibly go any harder, and 0 being really, really easy. And so aiming for about a 6 is good, and that's going to be different for different people. So one person walking a K at one pace might be that's moderate for them, but not moderate for someone else. It might be easy or extremely hard. So it really is based on how you are finding that exercise rather than what the exercise looks like to the outside. So another way of measuring this is just the talk test. So if you're finding it really difficult to hold a conversation, that would be more in the hard range. If you can still hold a conversation, but not so easily that it's a little bit harder, then you're probably around that 6, and that can be a good place to be to improve cardiovascular fitness. So that covers a lot of what an exercise professional, that's more their expertise. What my passion is having holistic programs. So this is you know, some people who are really passionate about exercise are really keen on getting you the best exercise stimulus. They think about working your body in a way that's going to give you the absolute best functional outcome. That can be great if you're doing something like preparing for surgery or prehab, and you really do, you know, you've got 3 weeks and you really do just want to be in the best situation possible. Then focusing more on that can be good. But when we're talking about adopting exercise behaviors and having a healthy lifestyle more generally, we need to be holistic and balance all the things that our other priorities, other things that influence on our health behavior, our capacity at any one point in time. And in my opinion, the best exercise programs really try and balance these two things in a way that recognizes everybody's goals and needs, and in a compassionate way. So just checking. Oh, I'm not sure if you can see that, but I don't know how to get rid of it. So that covers what to look for in a professional and an exercise program, and I hope that is a little bit helpful for those that didn't already know that information. Kind of put my behavioural science hat on for a second, and just try and communicate how it is that we are trained to think about people's behaviour and how we might go on and then apply that in practice. And do just a little bit of an exercise, and my intention is really to help you reflect on some of the things that, if you are struggling with exercise or you're doing really good at exercise, why that might be the case. So this is called social cognitive theory, and it was developed by Bandura, and it is one of the most influential theories of health behaviour that exists. And it's a lot of intervention programs and a lot of health practices are based on models like this or this model. And in English, what it means is that we're saying behaviour is impacted by outcome expectations, which is really what we think will happen. So if I engage in exercise, will it be good? Will it be bad? Will it help? Will it not? Self-efficacy, which is really just how confident you are to do the actual task. So, you know, to do weight training, to run, to swim, and how confident you are to overcome all the barriers that you may have to doing exercise. These social cultural factors, so it might be things in the environment that are impacting on you, both positively and negatively. So do you live alone? Do you have support people at home? Do you have access to equipment? Can you afford equipment? Those sorts of things. And all of these factors are supposed to impact on your goals or intentions. So often it's quite hard to do a behaviour if we have obviously no desire or intention to do it. So with no, so these are just some quotes. I'll just check how I'm doing for time. These are some quotes from cancer patients I've worked with, just to illustrate it. So exercise didn't help me prevent cancer. Why would it help me now? I won't like it. I hate exercising. It might give me some advantage, but I think I do enough already. I suppose some people don't know how to do exercises. This is also an example of a socio-cultural factor. So depending on where you are in Australia, there might be extreme heat or extreme cold weather. So it's motivation, gale force winds. Seriously, it's the weather that affects my ability. Bitterly cold and freezing. I did see an exercise physiologist for 10 or 12 weeks, but it got a bit expensive. Or I live 2 hours from the Peter Mac where programs are available. So you can see that if you have all of these factors, you're unlikely to form a goal, and therefore you have no goal-directed behaviour. So I think it would be useful if we can to try and test it. So I'm not sure if the chat's there. So what I would like, I normally would get people to raise a hand in this situation, but I think that would be difficult. So maybe if you can just type yes or no. Please type yes if you believe that exercise is beneficial. Okay. Thank you, everyone. Now type yes if you are confident that you can complete some kinds of exercise and you are confident you can overcome exercise barriers. Type no if you're not, if you're happy to. Okay. Now, if you feel like you have support, if you have support to overcome any barriers you do face, and if you have access to somewhere to exercise. Okay. And if you have a goal to exercise, or you have a goal related to an outcome for exercise. So it might be, for example, weight related or being fit enough to go on a holiday, that sort of thing. No. Okay, one no. Oop. Okay, final one. Now type yes or no if you do as much exercise as you would like to or think you should. Okay, great. So thanks everyone for participating. I think it's a really good demonstration that this sort of model, there's something missing here, because people are saying yes to all these things, but then there's still this gap here where we think it's good, we have the skills, we can support to overcome barriers, we even have a goal, but yet there's still this gap between our behavior. So there's something missing. Scientifically, these models do explain a fair proportion of behavior, but only about 45%, which means that if I assess you on all these things, I'll be able to predict to a reasonable degree if you'll be doing some exercise. And we have been able to help people by using these sort of models. So, for example, giving people education to help them understand the benefits of exercise, giving feedback and clear instructions to help with self-efficacy, providing access to equipment, providing exercise buddies, peer support, teaching people how to plan and serve goals. We have found a really useful and can work to help people change their behavior. However, there is clearly more that we can do. And there's two ingredients that I'm really interested in, I think are important for helping people to maintain exercise. So starting exercise is one thing, but maintaining it is another. And the type of motivation we have is associated with maintaining exercise. So basically, we think of motivation as a continuum from not at all motivated to motivated by somewhat external factors to being motivated by really intrinsic factors. And external factors might be things like fear. So it might be like fear of or trying to stop feelings of guilt. It could be that you really want a reward associated with exercise, but you don't want to exercise yourself. So in the general population, this might be something like losing weight, but you aren't motivated by actual exercise itself, all the way to really intrinsic motivation, which is doing something because it interests you, you get enjoyment and inherent satisfaction from it. And so what the research has shown is that having this more extrinsic motivation, but that is really related to your core values, so you feel like it's of personal importance. So if you really hold dear the benefits of exercise for overcoming cancer treatment and you feel like that's really of importance to you, and it's not really about guilt, but it's doing something that's important to you, you are actually more likely to uptake exercise than people who have more extrinsic types of motivation. However, the people that are more likely to maintain it are those with more intrinsic motivation, which is not surprising. It's basically saying we're more likely to do things that we enjoy doing than things that we think we should do. And that has implications for the types of exercise and how we implement those to try and make them, satisfying and enjoyable. So I guess this is an invitation to reflect on how much you've enjoyed the programs and why, and to seek those things out in the future. The other thing is habit formation, and I think this is something that available programs we could do a lot better, and it's really important for maintaining exercise. So habits are not just about doing something regularly all the time. It's more about doing something automatically. So like brushing your teeth you don't really need an action plan to brush your teeth. You don't have to track it on an app how many times a week you brush your teeth. It is something that we now automatically do generally. And the way that we have learned to do this is that we have a particular cue or context that we repetitively do that in. So for me, it's always been in the evening before bed. So that as soon as I start thinking I'm going to go to bed, I activate this automatic behavior of brushing my teeth. And that is really formed through a lot of pairing that context or that cue with that behavior through repetition. And we can do similar things with exercise. And it has implications because we don't have this ongoing ability to self-regulate, and it can be really draining, really draining to be constantly having to plan and track our exercise and try and maintain it. So this is illustrated by one of the prostate cancer patients I work with, who says about going swimming every morning with his wife. Well, we are sort of in a routine now. That simplifies it, and we psychologically adjust. On the offside, though, you do have to put work in. I'm cut out.
You just cut out just for about 3 or 4 seconds. It's all good. Back again.
Okay, thank you. Yeah, basically, habits are really great. They mean that we don't have to be motivated. We can just automatically do things. But nobody spontaneously started spontaneously brushing our teeth. We do need to put effort in the beginning. But focusing on having a routine and knowing what the contexts are and which are going to spur us to exercise can have a big impact on being able to maintain that. So just checking how I'm going for time. So behavior change tips based on some of those reflections. It is important to build confidence. It's really great that most of you all said yes, that you feel like you have the confidence. I think self-compassion, I've been thinking that a lot with COVID at the moment, just making sure that we are being kind to ourselves when we're thinking about our own exercise behaviours is really important. And otherwise, just exercising at that sweet spot where it's challenging enough to be satisfying, but not so challenging that it's not enjoyable and is damaging to our confidence. Building a routine in order to form habits. So you can have a to-do list, a quite long to-do list, and we know things tend to fall off it. What we need is a schedule. So we need to actually plan a little more and have clear goals around what it is we want to do. And then try and be consistent. So a time is probably not as useful unless you're a very regimented person. So after breakfast, for example, is going to be a lot more flexible than at 9 a.m. So if you think you're going to exercise after breakfast on these days and you continue to do that, after about 8 weeks, you should start to find that after breakfast, it's just something you automatically do. You don't need to talk yourself into it every time. And finally, find joy. So exercising with others can be really beneficial, putting on music and setting yourself up for success and sense of achievement can help you continue to maintain exercise, and really thinking about the mental health benefits, because that's something that I feel I get from exercise straight away, whereas some of the other benefits take a bit of time to accrue. So just being present around those things as well. So I know I'm running out of time and I want to get to some questions. I just wanted to quickly talk about 2 studies. So my fellowship funded by the Victoria Cancer Agency is really about trying to implement an exercise service across 2 hospitals in Melbourne. And to do that, I'm currently running a survey nationally to, I've already spoken about that a little bit, but just to inform what that should look like and what some of the barriers and challenges are. I'm looking for people who have the lived experience to help co-design that service, which means having conversations via Zoom and workshops around, the ideas of what that could look like. I'll then be doing a research trial to collect data on how well it works, and then advocating for that to be put into practice within those hospitals, but then also hopefully scaled up around Australia. So this is sort of my big project that I'm working on over the next 4 years. And I also just wanted to flag, and I can put some of these links in the chat if people are interested, or you can email me. We're also running a survey looking at people's experiences during COVID. So anybody with a hematological diagnosis who are interested in understanding how it's impacted on your treatment and your health behaviours and access to telehealth. And we're also looking to interview healthcare providers, to survey healthcare providers around their experiences having to change the way they deliver care as well, with the ultimate goal of being able to provide some care recommendations to organisations and policyholders. So thank you, everybody. It's my email address there, camille.short@unimelb.edu.au. Very happy for anyone to reach out, and very happy to answer any questions people might have.
Wonderful. Thank you so much, Camille. That's really interesting. It's really good to go through the whole journey of getting into exercise. Very complicated sort of thing, especially when you throw cancer in the mix and getting back into exercise. And I will forward again to everybody who's come today the survey, how to get onto that, the research as well. So, and all the other links
great.
we put through as well. So thank you so much. We've got a few questions actually, and comments as well throughout the post. Let me get back to the start. Here we go. From Linda. Yes, a few. We'll put the links up. So there's a couple of questions and comments there. Hi, pre-treatment, she had CHOP, which is quite a significant bit of chemotherapy that you may have heard of, Camille. I play tennis once per week, as well as yoga and walking the dog each day. Post chemo, I return to doing the same as soon as possible. My muscles are weak and my joints click a lot. Will I return to pre-chemo fitness ever? You want to answer that a little bit, or what you can do to maybe help, and I can answer the medical side of things.
Yeah, it's hard for me to say. As I said, I'm not an exercise physiologist, so I'm not as attuned to the physiology, the anatomy side of things. I can only really answer based on people's experiences, and I think that unfortunately there are, significant toxicities with chemotherapy, and all I can say is that doing the exercise to be as healthy as you can is going to be very preventative, but I can't answer if you will get back to the same level.
I think it's.
Do you have a comment on that, Donna?
Yeah, no, I think it's really good that, obviously you were quite fit beforehand, and that's going to go a long way to getting back to some normality in your fitness in the future. You didn't mention how long ago your treatment was, but it can take a good 3 to 6 months to start getting any sort of normality, especially sounds like you're going back into what you were doing beforehand, which is great. And a lot of people can't do that. But it can take a good 3 to 6 months to sort of get your muscles to get back into any sort of shape. There's quite often a lot of inflammation with lymphoma and recovering as well after the treatment, to sort of in the joints and things like that too. And it can take a little while to settle down, and you can take with CHOP a good at least 6 months. So keep at it, and you're definitely on the right track if you're getting all that exercise in, that's for sure.
I think it's a good question, because I know that I have heard some people say that they didn't think they ever would get back, and obviously that impacts on your motivation as well. So I think having that, it's good to ask the medical professionals so you know what to expect, but it is good to have that hope, I guess, that with the right time that you will be able to recover that.
Yeah, no, definitely keep at it, and you're on the right track, and hopefully it gets back to some normality. There's just a comment from Callie that she does use a phone app to track must be her exercise, and using podcasts and audio books are good. It's her time, and also she'd like to be a part of the your research. So great. There's a few
Great.
people saying they
Thank
want
you.
to be a part of your research. Is walking enough, or should we be aiming for more weight training as well? I guess we can answer some
I can answer that. Yeah, I think so. It really does depend on what your goals are of what you want to get from exercising. Walking is absolutely fantastic. What weight training just has additional benefits that can be really good for your strength and really good for us as we age. So, and it's something that is actually really easy to do at home, and in like 10 minutes you can do some exercises. So I think with the benefits you can get from it, I would absolutely be aiming to do that. But if you end up, mostly doing walking, I also wouldn't give yourself a hard time about it. But absolutely, I would recommend doing both if you can.
Even just going up little hills is to start building your muscles, and it is quite important, especially with patients who've had treatment for lymphoma. There's been a lot of research into recovery and a high risk of getting osteoporosis from a lot of the treatment that you had. So weight-bearing exercises is quite important to try and hold on to that calcium in your bones so you don't have future issues. So that's great.
And a lot of our programs use things called TheraBands. So that's just some bands that you can get that you can do from home. I'm currently pregnant, so I've been watching, doing some telehealth programs with resistance training using those sort of bands. And you don't need much space, and they're really cheap. And there's some good resources around what exercises are appropriate. So could be an easy way to start integrating some of that.
Yeah, and it's a lot less stressful on the body. You're using your own resistant, aren't you?
Yeah.
So what is good exercise for people who are suffering from bad fatigue? Because that's a massive problem with hematology patients particularly.
Yeah. It does depend, I think, on what you have access to. Like walking is good. I think multimodal exercise can be good, but you just want to pace yourself. So, the research evidence suggests that you can't beat fatigue by rest alone. So some exercise is good, but it just means that you also don't want to overexert yourself. So walking is great unless you think that it might be that you walk in a loop, so that you don't walk, too far and then you realize you have to come back. And if you have any balance problems, then it can mean that can impact on whether or not you'd go walking out in your environment or things like that. But I'd be happy to kind of follow up with any of these questions if you like. I can send through some answers. So.
Oh, great. Yeah, thank you. I'll definitely put your email address up. And Mary's made a comment that, and she's a health professional, so regretfully, a lot of hospitals are under-resourced, and a lot of people aren't actually understanding the benefits of exercise. They're starting to now, especially as the COSA guidelines out there to promote exercise in health professionals. But we do realise that it's a topic that health professionals need to bring up more often with patients as well. I think we get a bit focused sometimes on the symptom management and the treatment, and not referring patients through appropriately. So some places do have exercise programs. She mentioned the Chris O'Brien Centre as a pay-for-exercise program. If anyone out there is from Chris O'Brien, and you've mentioned a few other ways of people can get onto exercise programs in their areas as well. And we'll put those up.
Yeah, often local cancer council, some I know at least in Victoria, Cancer Council helplines keep a list of local programs. So there might even like going to a Heart Foundation walking program, if there wasn't a cancer specific one in your area, might be a good start if you're looking for people to walk with. But there are sort of community programs, it's just often a bit different to having somebody, you know, write you a specific program for what your health challenges are. If that's intense fatigue, then it's good to get someone who can help you and create something for you for good days and bad days.
Yeah. And like I know, especially in Victoria, I think it might be New South Wales too, like XMed is quite good for cancer patients too. So obviously work with cancer patients on a regular basis. And again, what you said before is ensuring it's someone who knows what they're doing. Do you have any idea the costs of an EP session, like exercise physiologist session?
Yes, I do. Although it does depend on if you're, so if you go through a GP management plan, that can be bulk billed. And it does depend. Some will do group-based sessions and some will do individual sessions. That could be, you know, similar to a physio, like $50, $80 a session. Some people might pay 120, so it's worth doing some calling and getting that information before you. There's also, I think my colleagues in Western Australia who have been leading a lot of research in prostate cancer have just set up an online business for exercise and cancer, so via telehealth. So there might be some models that are cheaper that are delivered, like not face to face, but have still got people who really know what they're doing in them that are paid. But I'm not sure how much their program is.
And that's the thing, it does add up, isn't it, all these sessions? And if you want to see a dietitian and trying to get back into health, it can be quite difficult. Just got one last question. It's a really quite a feasible one, especially at the moment, but even without COVID-19, this is really important, is infection issues and like as Carol's mentioned, she's avoided gyms due to germs, but I'm interested in attending a rehab centre for exercise. But I assume as they work with patients, the standards of cleanliness would be better. I would like to think so. But unfortunately, our gyms are, well, you can't go to a gym in Victoria at the moment, but gyms can be a bit of a area of infection issues, and ensuring that you wash down your machines before you're using them, and it'll be the same in a rehab centre too. And just ensuring that you wash your hands after you complete your exercise and try not to touch your mouth. It's all very important.
Yep.
Yeah.
And I think it's okay to raise that with staff and ask them what their procedures are, and they might be able to give some reassurance or come up with some strategies that way.
Yeah, I'd like to think in a healthy area that would be a bit more conscious of infection control issues. Just checking on the other board. If you're tired, should you exercise through it? From Tony, which is a good question because, yeah. Do you want to?
Yeah.
That?
Yeah, I think it depends on what you mean. If you're tired and you think, I don't really feel like exercising, I would rather maybe just have a rest, then you might find that going and doing some exercise helps give you energy. But if you're feeling that really terrible fatigue, it might be fine to rest. But if you're going to be constantly feeling like that, then I think trying to do something really small. So it has to be a graded task, and that's what I mean about it being relative to you. So if it's just good to get up and move. So if it is about getting up and going to, collect the mail, and, that's absolutely tiring, that's where you're at, then it's good just to get up and do that if you can. But you don't want to be like pushing yourself into further exhaustion with like a really long session. So just like smaller sessions when you're really tired, it could be 5-10 minutes, can definitely be beneficial, but you don't want to push yourself so much so that you're lowering your immune system and feeling worse.
It depends, obviously, if you're in amongst treatment and things like that. It might be body saying, slow down a bit.
Yeah.
I really liked your suggestion before, and I'm going to use this in the future. I didn't really think about it, but having a small circuit. So, just go off and have a little short little walk. And if you feel better, well, go for another lap. So,
Yeah.
yeah.
So That study I put up by Minter, they're having people exercising as inpatients after their bone marrow transplants.
Mm.
So obviously that's going to be an issue. People aren't going to be feeling like they can do much.
Yeah.
But they'll be getting them to do just a little bit to get out of bed, keep blood flowing, that sort of thing. So yeah, it doesn't have to be half an hour every time. It can be just a really small bout to get some fresh air and to move a little.
Yeah, we used to get our patients out and doing laps around the ward. It was a big circle. So so you meet them, go for a walk with them for a lap. And just finally, as last one is a comment more than anything else from Callie. So thanks for your suggestions, Callie. And she just letting you know that she has exercise physiology appointments program weekly with over telehealth, and she's finding it's really helpful. So it's definitely something you can mention to look into at this time.
So can anyone answer the question who has seen an exercise physiologist for the person that asked it, how much it's been costing them? If I know that's personal information. So.
Yeah, do you know, is it costing you anything or is it through the hospital? Not sure if she's still there. Oh, she's still there. Oh, bulk bill with care plan.
Okay, yeah.
That's good.
Cool. So obviously it might cost you to see your GP. I know that can happen, but you should be eligible for that chronic disease management plan. And I think some of the things I spoke about in terms of the behavior change techniques is just good. So if you have your 3 sessions or 5 sessions and you can't afford to keep going, that you know, you work with them to make sure that they have given you a plan that will sustain you for a bit, and that you have some ideas around how you might be able to keep doing that when you're managing it yourself, or structure your sessions with them. So if you know you can't afford beyond 5 sessions, so that you can still check in with them over time.
Yeah, and that's a great
idea.
idea.
You have someone to be accountable for and to help you if you're not sure about techniques and things like that.
Oh, that sounds good. And please download our exercise and lymphoma fact sheet as well. Just it actually outlines of quite a few of these things, including exercise programs and chronic disease management plans and things from your GP. So thank you so much, Camille. We'll be putting up all your links, and also those who want to be a part of the survey, which I think is vitally important. And this will help, you know, hopefully make change in the future, and how important and showing hospitals that, you know, it's really important to have these exercise programs for their patients. Thank you so much. Thank you everyone
for listening.
Thank you.
Bye.
Bye-bye.